Joining me now is Andrew Mulcahy, Senior Health Economist at the nonpartisan think tank RAND Corporation. Welcome, Andrew, and let's get right into it. What are the components that go into prescription drug pricing today?
Thanks for having me, John. It's a complicated market and a complicated question. The real driver of drug prices in the US is what drug companies charge for these drugs as they're sold into the market. It's really hard for consumers, for any of us, including researchers, to understand what prices are actually paid for drugs at the end of the day after drug companies make deals with health insurers and their pharmacy benefit managers. The drivers of high drug prices that we talk about in discussions like this, John, are really expensive brand name drugs. For some other kinds of drugs that represent the bulk of the fills that patients pick up at pharmacies or get mailed to their house, those are with much less expensive generic drugs. So there really is this important versus much less expensive generics. I think that distinction is important to keep in mind.
So now, briefly, is it fair to say that one of the primary components of higher drug prices is research costs in the development of drugs?
Yeah, I think economists have a different take on this. My take is that no, the research and development is clearly a very expensive endeavor, risky, very long, over many years, and not to discount any of the importance of that investment to bring a drug to market. But once a drug is approved by the FDA and ready to be sold, the link between the price that companies charge and those upfront investments isn't direct. I don't think we should generally think about high drug prices being driven by expensive investments in R&D.
So, Andrew, it's a well-known fact that most of the industrialized nations, at least, prescription drug prices are much lower than they are in the United States. Why is that?
Yeah, it's another great question. We've done a lot of research on this and found that on average for brand name drugs, US prices are 2 to 3 times those in other countries. Many reasons for this. The most straightforward one is that other countries have policies in place to keep prices for brand name drugs lower. And the US doesn't have that kind of federal level kind of national policy perspective. We do have some constraints on what drug companies can price drugs at in the US. A lot of it stems from negotiations between drug companies and pharmacy benefit managers. So that does help a little bit, but we don't have the kind of entities that exist in the United Kingdom or Germany or Canada that put some kinds of bounds on how high drug prices can be relative to the benefits that they offer patients.
So when you say they have some programs, what are can you describe a little bit more about what those programs are in the other countries?
Sure, there's a range of different approaches to this, some a little more direct and some a little less. In the UK, there's NICE, which is an entity that looks at all of the evidence around the effectiveness of a drug and goes back and forth with patient advocates and drug companies and researchers to try to land at a sweet spot between what a drug offers to patients and how much it should cost. Germany has a similar body called IQWiG that does the same kind of analysis. We do some of that in the US. There are organizations that try to provide this kind of information and analysis on the value that drugs offer as a service, but that's done mostly in the nonprofit and private sectors, not at the government level.
The common question in the United States today seems to be to force those other countries to pay their fair share, so we're not paying the overwhelming freight for the research and development costs of drugs. Is that a fair argument?
Yeah, I think, John, I struggle with that too from the point of view as an economist thinking about this. I think there's no doubt that companies make a lot of revenue from the US, but the link between that kind of revenue and investments in R&D is a tricky one to nail down. And the evidence there, I think, is mixed. So I think it is fair to say that if drug prices were higher in other countries, on balance, we might expect some more investment in R&D. But that's not quite the same thing as saying that those countries are free riding on R&D investments from the US.
So what should we do in the United States with respect to our system?
Another great question. I think this is partial to a researcher kind of perspective to answer that question, but I think it's a solid one. And that's, I think we should do some of the analysis in-house, domestically, in the US, to figure out what the value proposition is from drugs. And it's very important to note that when the FDA reviews all of the clinical trial evidence from a new drug, they are just focused on safety and effectiveness. They don't look at costs at all. And that the job of looking at what a drug offers to patients relative to the cost comes down to individual patients and to their prescribers and to insurers and their PBMs. And in our US healthcare system, which is fragmented in the way it's set up and who's responsible for those kinds of decisions, where you land in terms of a decision on whether or not a drug at a certain price is good or bad value can be all over the place. And that creates a lot of difficulty for patients who might be switching between different kinds of coverage or dealing with a PBM or an insurer who may be changing their formulary, on a routine basis. So I'd argue for an approach that's anchored on objective data and analysis. It's really hard to argue with some of those analyses that show that at any reasonable price, a new drug, well, it may be new to the market, just doesn't really offer much or anything to patients.
So what about the Trump administration's efforts to impact lower prices for prescription drugs?
Yeah, all I can say is that they have a lot of irons in the fire. There's efforts to make deals with drug companies. There are efforts to have new models in Medicare to help tackle drug prices. Recent announcement to have a drug price model in Medicaid, and many other efforts. And I think part of the challenge with assessing the likelihood that any of them individually or collectively will have much of an impact is this question about what price we're actually talking about. I hinted at earlier, there are these behind the scenes negotiations between drug companies and pharmacy benefit managers. It's really hard, even for the government, to understand where a price lands, what kind of money the drug companies are making is actually very tricky to figure out still today, even with all of this new information and data the government may be collecting. So I think that's an important limitation. It's easy to say that we're making a deal with the drug company. It's hard to say how that will actually end up affecting patients' out-of-pocket costs or how much we're paying for our drug coverage.
Senior Health Economist Andrew Mulcahy, thank you so much for a great conversation.